Bulging disc treatment is a very common requirement of patients who come to an Ayurvedic hospital. When we want to talk about bulging disc, it is very important to understand a little bit about the intervertebral discs. When we talk about a disc, it is actually a cushion that is between the two vertebrae. Between every two vertebrae in the spinal system, in the vertebral column, you've got a disc which acts like a shock absorber. And this disc is made up of two parts. An external fibrous layer which is called as the annulus fibrosus and an internal layer which is pulpy and is known as the nucleus pulposus. This arrangement enables the disc to really act as a shock absorber and disperse the strain that happens when the vertebrae are compressed. However, with age, the elasticity of the disc comes down. That is because the water content in the disc comes down, and that stage is known as the dehydration of the disc. With progressive dehydration that takes place with age, the disc becomes vulnerable and it gets compressed. The height of the disc comes down and the disc starts bulging outward or externally. This condition is known as a bulging disc. This level of bulging can be the initial stage of a dehydration of a degenerative process soon after the dehydration. But bulging disc as a word is also used to denote a stage of a herniated disc where, after a stage where it just bulges out, it can also sort of crack and lead to the prolapse or the extrusion of the internal nucleus pulposus through the cracked annulus fibrosus. And that stage is known as the herniated disc. Vaguely or colloquially, even the stage of a herniated disc is sometimes known as a bulging disc. When we look at the treatment for a bulging disc, typically a bulging disc at some points of time can be totally asymptomatic, whereas in others it can lead to pressing on the nerves that are emerging from the spinal cord, and in which case it leads to pain that is manifested in the regions where that nerve is supplying. For example, if the disc in the neck is bulging and it is touching on the nerves that are emerging from the neck, it can result in symptoms in the scalp, in the shoulders, in the chest, in the neck, as well as in the hands. Whereas if the discs in the lower vertebrae, that is in the lumbar vertebrae, if they are bulging, they press on the nerves that emerge from the lumbar vertebrae and supply the legs. So pain, numbness or tingling sensation, loss of strength, etc. are some of the symptoms that can manifest when these nerves are compressed by the bulging disc. At times, the bulging disc can also compress the entire spinal cord and lead to problems at the lower levels, below the level at which they are actually pressing, because the spinal cord contains nerve tracts which lead to nerves lower down in the body. So if a cervical disc is actually bulging, it can also touch on the spinal cord and result in problems like bowel incontinence, urinary incontinence, so also to constipation. It can lead to a sort of weakness in the lower limbs and so on and so forth. So these are some of the symptoms that happen with bulging disc for which people seek intervention or treatment. Conventional treatment is basically to provide rest and physiotherapy for a certain period of time, as well as the administration of pain-killing medication. Very often, the problem is self-limiting and the patients become free of symptoms within a very short period of time. However, there are some patients for whom the problems consistently continues to be there. There are also patients who keep aggravating with time. Very often, they are recommended for surgery. Whereas that is where most of the people get the benefit of seeking Ayurvedic treatment. Ayurvedic treatment offers a very wonderful solution without the need for surgery in treating patients who have got this bulging disc resulting in these symptoms like pain, numbness, loss of muscle power and so on and so forth. The Ayurvedic treatment comprises of internal medication. We also have some external therapies whereby we administer oil-based therapies and certain herbal powders as external therapies. We also have a very important concept of treatment called Vasti, which is very important in nourishing the disc as well as in helping the nerves to heal after they have been pressed by the bulging disc. Though structurally the bulging disc doesn't go back to its original position immediately, there is a significant relief from the symptoms which is sustained. Also, the nerve that is compressed and which gets sort of damaged gets repaired in the process, leading to a long-term survival. This is one of the conditions for which a lot of patients seek Ayurvedic treatment and are extremely satisfied with the results thereof. We at AVN Arogya offer the entire spectrum of Ayurvedic treatment comprising of internal medication as well as the external therapies. We also integrate our treatment with modern physiotherapy. In cases where it is needed, we also have the services of Western doctors who can help in the management of these conditions. So, thereby, we offer this holistic intervention to disc bulging, and that results in a wonderful solution to the patients. It's also very important to understand the role of exercises in the treatment of back pain, especially in the case of bulging disc. So we have devised a set of exercises based on yoga, which are very good to sustain back pain or neck pain on a regular basis. If we can practice these exercises after the relief from the problem, it will go a long way in preventing further episodes as well.
Go here to subscribe.